types. One is a hemodialysis, another one is a peritoneal dialysis. Second is a peritoneal dialysis. First one we have to see about the hemodialysis. Hemodialysis is also known as an artificial kidney, which replaces the functions of the natural kidney, which excretes the waste products from the blood, managing fluids and balancing electrolytes level. For that we have to first see about the block diagram. First thing, from the human hand, the blood is taken out and it's sent to the pressure monitor. The important role of the pressure monitor is to find out the pressure in the blood. Then it moves to the then the heparin is added. The heparin function of the heparin is to remove the blood clot. Then it moves to the dialysis. This is known as a dialyzer. This is a dialyzer inflow monitor. It monitors the how much the blood is going to enter into this dialysis. Dialysis consists of this hollow fibers, which is mainly made up of the cellulose. The cellulose is mainly due to it has mainly absorbing capacity. So the dialyzer is made up of the cellulose. Then after the removal from the waste products, then the pure blood is sent back into the human hand. Okay, this is our hemodialysis. It consists of the components like dialyzer, dialysate solution, blood pump, monitor and control system, then heparin pump. First is a dialyzer. It removes the waste products from the blood. It's a dialyzer. Then it's a dialyzer. It consists of this hollow fibers. This hollow fibers, when the blood comes in the one direction, it consists of the dialysate solution. The dialysate solution flows into this opposite direction. Here the osmosis process takes place. The osmosis process is nothing but the substance moves from the higher concentration to lower concentration. Here the minerals moves from the unwanted minerals, the unwanted waste products moves from the blood and it's carried out through this diffusion process. Then the remaining pure blood is again moves to the human body. This is the process of the hemodialysis. It takes place 3 times per week. It takes up to 3 to 4 hours. One dialysis process takes place up to 3 to 4 hours. Then we are going to see about the peritoneal dialysis. Peritoneal dialysis is nothing but below the abdomen there is a peritoneal cavity. In that peritoneal cavity we have to surgically insert the dialysate solution into the peritoneal cavity and then the peritoneal process takes place. The waste products and the process are collected. After few hours we have to remove that pump and then we have to remove the waste products from the body. In that way the peritoneal dialysis takes place. Next topic we have to see about, that's all over the hemodialysis. Next we are going to see about the external counter pulsation technique. used for the heart failure patients. When the patient is having severe heart attack, this technique is mainly used. It's a non-invasive technique. It's mainly used for some mild heart failure patients. It involves the use of the inflatable cuffs. The cuffs are mainly attached to the leg. For example, this is a leg. We have to attach the 3 cuffs. And this cuff is attached to the ECG monitor. Okay, but when the heart is under the systolic condition. Systole means it's a contraction, and diastole means a relaxation. When the heart is under the systolic condition, means the heart is contracts, the blood from the heart. This will be in the relaxation condition. It happens in the vice versa. Contraction happens in the heart and the relaxation takes place in the leg. In that way, the heart functions. We should not give the heavy load to the heart. That's why we are using this external technique, which makes the heart works easily. So contraction here happens, relaxation there happens. When there is a contraction, here relaxation happens. In that way, the blood flow movements takes place. This is the technique for the ECP. It's a non-invasive technique. It is a very cost effective and compared to this open heart surgery that's and all. These are some clinical benefits are the reduction in angina symptoms and improved exercise tolerance. We can increase this quality of the life also increased, and improvements in the symptoms of the heart failure such as shortness of breath and fatigue condition. That's why we are using this technique. And then what are this contraction means? It's a severe valvular heart disease, uncontrolled hypertension and significant arrhythmias. These are these contractions.
Sir, time come here.